Well, hello, hello. This is Dr. Isabella Mig, your friendly rheumatologist, and we are going live for an episode of our Rheumatology 101 regarding the flu. This is particularly important if you're someone who has an autoimmune rheumatologic condition. And we are going to learn a lot today. We're going to learn about, why the flu season is particularly severe this year. We're going to learn what you can do to prevent and what you can do to make it go away a little faster. Okay, so hopefully, if you are watching this live, please write hashtag live. If you're watching this on replay, I would love it if you could write hashtag replay. As always, if you are patients with a rheumatologic need, please know that we are still accepting new patients in our rheumatology practice. Very soon, we will be able to accept pediatric patients, so stay up to date on this. And it will be a pleasure to get you achieve remission if you have a rheumatologic condition. So today's episode is about the flu. So the flu is a big issue right now. There is actually a new strain. It's not a super flu, but it is a strain that has a little bit more changes. And so our vaccine may not be as good as, for example, the years before. And also, it's one that has a little bit more severe symptoms. So it's called, I don't know if you're interested, it's a subclade K. So you may have heard this in the news. And it's about 90% of the flu this season is due to that. There has been more than 17 million of Americans who've already had the flu. So it's a lot. There has been death. And we've definitely seen an increase in hospitalization. So this episode is definitely for you if you have a rheumatologic condition and if you are on an immunosuppressive agent, such as a biologic, such as medication that decreases your immune system, so we get you in full balance of your immune system. In fact, I would also argue that if you are someone who has severe rheumatologic condition that's very inflammatory, and maybe you're like, oh, I don't want to take my medication because of the flu season, for example, well, I will tell you, unfortunately, your immune system is also compromised because you're just like your immune system is so looking at creating inflammation to help you heal from all of the things that it thinks that it needs to help you heal, right? Like all of this inflammation of the joint and all this. So you don't have as robust of an immune system as someone who doesn't have a rheumatologic disorder. So don't think that if you have severe rheumatologic condition, such as rheumatoid arthritis, lupus, and so on, do not think that not getting medication and you're maybe potentially afraid of the medication, that is not going to actually help you down the line, because your immune system will also be weakened. Okay, so let's talk about this flu. So this this flu, the subclade flu, right? So it's about 90% of the case. We know we've looked at the UK, and that's also where they had like the highest form of this is what we are seeing, and as the big question is, should we get vaccinated? So yes. Yes, if you have a rheumatologic condition, it's a yes. There's no question for me. If you have a rheumatologic condition, unless you have had a complication with a vaccine, go ahead, get vaccinated. Here's the thing. Even if you were to do a flare, which honestly, I haven't seen this year with the vaccine, but even if you were to get a flare from this vaccination, we can take care of the flare. But the flu this season is particularly severe. And my recommendation is get the flu vaccine. Number one, it decreased. So even though you may have heard that it only prevents 30 to 40% of the flu, the thing that you're not also listening to is that, yes, it may prevent only in 30 or 40% of the cases, but what it actually does is that it decreases the severity of those symptoms. if you are immunocompromised, your symptoms can actually put you in a hospitalization and potentially more severe, because then you can get like a pneumonia, which is an infection of the lung. We don't want this. And so what we want is to make this flu the mildest cold possible. And so, yes, maybe some of those patients who had the flu, even after vaccines, are saying, I have had the flu. But what we haven't actually looked at specifically is, do they actually have less symptoms? So it is recommended to get vaccinated if you are pregnant, if you are a healthcare worker like myself, or if you have any sort of immunocompromise. So if you are older, definitely you want to do that. And if you are on with a rheumatologic disorder, we would also recommend that you do that. Okay. So, and then the thing that's actually interesting is to realize that the flu is actually a very contagious, sorry, what am I saying? Infection. And so if there is, I remember this thing where we were saying, if there is someone in the amphitheater we were at to learn medicine, if one of us had the flu, they would actually give it to about 50 people around them. That's how contagious it is. Okay. So this is the winter, as you can see with my jacket. And so the issue is that we are in closed spaces. In closed spaces, we are going to contract viruses more often, and the flu is prevalent. Okay, so what you want to do is, get the vaccinated if you can, again, if you have no contraindication. And then the second thing is, if you do get the flu. And so I'm going to talk to you about two things. One, if you know about someone, so for example, you had a party last night, and then today one of your friends is saying, oh my goodness, I knew I wasn't feeling that great, but here it is, I have the flu. If you know like this, that you have the flu, that you have been exposed to someone who had the flu, my recommendation, and our experts' recommendation in general, is that you should get on Tamiflu. Okay, Tamiflu are one of the new preventative drugs. The goal of Tamiflu is to decrease the duration, but it's actually to decrease the viral load that's out there, like inside of you. And so by decreasing the viral load, what you're doing is that you're not developing as severe of symptom. You're also preventing other people from getting it. So if you're in a household, what you don't want is maybe like give it to someone else, right? So you don't want to give it to other people. And so I would recommend to get the Tamiflu as soon as you hear that you have been in contact with someone with the flu. The issue sometimes is that you may learn that you have been in contact only after 3-4 days. Some people will say, oh, don't take the Tamiflu since it's past the time. Well, that actually, I would not recommend that. I would actually still recommend to get Tamiflu, or again, those other drugs that are there, because we know that for someone that's immunocompromised, it will actually also work. So I would just go ahead, try it. So in general, my summary would be, get the vaccination. If you get in contact with someone that has the flu, get the Tamiflu or the other preventative drug if your insurance allows, and get that done as soon as possible. And if you do not know, even after 2, 3, 4 days, if you are immunocompromised, do it also, and get it done as well. Now, there are drugs that are particularly problematic for viruses. It's one of my favorite drugs, actually, called Rituxan. So it's rituximab. It's a CD20 inhibitor. Okay, we have other CD20 inhibitor, but basically CD20 inhibitor, because they are targeting the B cell, they don't allow you to get antibodies. And so the response to vaccine is not as good. And two, when you get an infection that's a viral infection, you're not as good at getting rid of it. The only way, not the only way, but the people who are on both rituximab and IVIG or sub-Q IG, so immunoglobulin, those patients, I'm not worried, because you're getting immunoglobulin from the community. So they have already the antibodies against the flu. So I'm not worried about those patients who are on rituximab plus this. But if you're only on rituximab, please, please, please contact us. And I would almost argue that if anyone was sick around you and that they haven't had the flu many, weeks ago, that you could actually just go ahead, take the Tamiflu. It's preventative. It's better to prevent than to treat, because it's actually hard to treat. The flu, you don't really have a treatment for it. Okay, so that's what I'm recommending for this. The thing overall, if you have someone else in the household that has the flu, same thing. You put them on Tamiflu or those other drugs, and you can also like get it as well for you. So if one of the person around you has been in contact, have them get the Tamiflu, and then you can actually also get this. I think that the risk of Tamiflu is very low, and it's just better to protect you especially if you are on a CD20 inhibitor like Rituxan, Truxima, Roxians. Okay. When it comes to patients of on average MD, we're gonna, make sure that everyone knows this. And my recommendation is, if you're feeling under the weather, or if you have seen someone that's under the weather and lives with you, please contact us. We can just start a treatment, and we'll be there, and we'll be happy to see you. If you develop symptoms such as fever, body aches, chills, suddenly feeling like you're hit by a truck, contact us right away. Get a test to see if you have developed the flu, and we'll get you that medication. Okay. Also, remember, if you get vaccinated, it's not too late to get vaccinated. So go ahead, get that vaccination. And if you get that vaccination, know that it takes a little bit of time to actually build that immune response. It can actually take up to 4 weeks. So even if you could still get the flu, and it is not. So what I hear from people is like, oh, I got vaccinated, and 10 days later I got the flu. I think it's the vaccine that gave me this, or I've even had it. Like, I got vaccinated, the next day I had the flu. Well, here's this. It has nothing to do with the vaccination. It's just the vaccination takes a little bit of time, because it's your body that creates this immune response to prevent the flu and to prevent severe symptoms of the flu. Okay. In general, all the recommendations is make sure that everything is well aerated. You can wear a mask. Make sure it's an N95 if you're trying to protect yourself. If you have anyone that's sick, they should put a mask, like the regular, mask, certain mask that's like preventing other people from being sick. And just wash your hand regularly, often. No, one more thing that I forgot to mention is that in kids, very often the flu will present as abdominal pain, nausea, and diarrhea. And so don't forget that even though you may have a kid that has those symptoms, that could still be the flu. So you want to also look for this. Okay. In general, I think that knowledge is power. The more you know, the more you're going to be able to get to the bottom of this. It's always a pleasure to be here with you. I'm going to see if there is anyone on Instagram. Yeah. Hi, Diva. Hi, Reinventing Mom. It's always a pleasure to see you guys. And I'm just checking if there's anyone on. Well, I can't even look at it. I don't know where my stream aired is, but anyway, thank you so much for joining, and I will see you next week for another live. We've also started doing some live on Instagram, so don't hesitate. And oh, here it is. So hi, Clea. It's always a pleasure to see you. Thank you for coming. Hi, kids. Hi, Sophia. And as always, yeah, if you're seeing this on a replay, #replay, have a wonderful day, everyone. Take care. Bye-bye.